And you may want to introduce yourself a little further, Dr. Bridge. I just did the bare bones there.
Sure. Okay. So I'm Jeff Bridge. I am the director of the Center for Suicide Prevention and Research at Nationwide Children's Hospital. I am an epidemiologist by training. Delighted to be here. Just a few disclosures. So I received research grant funding from NIMH, the CDC, and PCORI, and I'm a member of the Scientific Advisory Board of Clarigent Health. So what I wanted to do in 15 minutes is really just provide an overview of the epidemiology of youth suicide and suicidal behavior. So think of this as a more descriptive presentation. We really don't get into the hows and whys, but just really frame the problem in our country and locally. So to orient you to this graph, so this graph is showing suicide rates from 1999 through 2018 among 10 to 19-year-olds in the US. And the blue line represents the suicide rate, and the bars represent the number of suicide deaths. And what you can see is from 99 through 2007, there was an 18% decrease in the suicide rate among young people in the US. But from 2007 through 2018, there's been an 88% increase in the suicide rate. In 2019, those data just came out. There was, for the first time in a decade, there's been a dip over the year-to-year rate in suicide, both among all people in the US, across all ages, and among young people. So to put this in another perspective, if you were to look at suicide in 2007, it was the 11th leading cause of death overall, 3rd leading cause of death for young people. There were more deaths from suicide than 2 leading medical causes of death combined, heart disease and cancer. If you flash forward to 2018, suicide is now the 10th leading cause of death overall, 2nd leading cause of death among young people. And there are more deaths from suicide than 20 leading medical causes of death combined among young people. And I couldn't even fit them all on the page, on the slide. To look at this from another perspective, so this slide is showing suicide rates, same 10 to 19-year-old period among males and females. Just wanted to show that the pattern was similar in terms of percent decline. And you can see that among young females, there was 147% increase in the suicide rate from 2007 to 2018, 75% in young males. What this slide is showing is it's comparing suicide rates among males to females in the US. And among young people, males have a suicide rate that's about 3 times higher than females during this overall period. And males account for almost 80% of all young suicide deaths. But the pattern has changed over time. So Dr. Donna Roosh and our group published this paper a couple years ago, looking at changes in the suicide rates among males and females in the US. And just to orient you to this slide, the blue line and dots are males, and the sort of goldish yellow are females. And what you can see is in the 1990s, the male to female gap was wide. It's narrowed over time, and it's continued to narrow. And what this slide is showing, so I'm not going to ask you to fully understand, there's a lot of information compressed on here. But if the male to female ratio was identical, so equal, these numbers would be hovering around 1. And what you can see over time in 3 different periods is that across different racial ethnic subgroups, the pattern is getting closer and closer to 1 over time. Whoops. When we look at methods of suicide among young people and males and females, males are more likely to use guns, followed by hanging suffocation, whereas females are more likely to use hanging suffocation, followed by firearms and poisoning. There is geographic differences in suicide rates among young people across the lifespan, but among young people, the Mountain West. So let me orient you to this slide. So red represents states with the highest suicide rates. The sort of tannish color is the second highest, followed by the light blue, and then the states with the lowest suicide rates are in darker blue. And so you can see that there's geographic variation here. Some people have asked, well, what are some of the contributors? Some of the thoughts here, access to firearms is one, probably insufficient because there are so many other factors at work here too. And we know for one thing that access to care, access to mental health services is more challenging in these areas compared to some other areas in the US. And I'm happy to take questions at the end if there's time, but I just want to be mindful of my 15 minutes. So when we look at suicide rates by race, young people who are American, Indian, or Alaskan Native, represented here in the green, have the highest suicide rates, both in males and females, followed by white youth. What I wanted to show here is that when you're comparing suicide rates within males and within females, one thing that stands out again is the very high suicide rates among American Indian, Alaskan Natives. But, you know, I mentioned about the suicide rate being higher in males than in females. But when you look by race, American Indian, Alaskan Native females actually have about a 35% higher suicide rate compared to Black and Asian Pacific Islander males. When we look at suicide rates by ethnicity, so suicide rates are higher among non-Hispanic or Latino or non-Latino youth in the US for males, and it's a similar pattern for females, but it's not as wide of a difference. Let me orient you to this slide. So what this slide is showing is suicide rates by age and sex across the most recent 5-year period, 2014 to 2018. If you look here, there are very few suicide deaths in children under the age of 10. So if you were to look back 50 years at suicide mortality data, in no year would there has there been more than 9 suicide deaths among children under the age of 10. But what's very clear with this graph is that with age throughout adolescence, you can see that the rates increase really exponentially among males and increase more linearly among females. So several years ago, probably 8-9 years ago now, there was a suicide of an 8-year-old girl in Columbus, in Franklin County. And a reporter called and asked me about how common that is. And I was pretty much sharing what I just shared on the previous slide. And it got our group to thinking about, we knew that rates of suicide had been going up. We decided that maybe we should take a look in children under the age of 12. And so what we did is we took 20 years of data from 93 to 2012. Suicide in children relative to adolescents is extremely rare. So we're presenting results here. These are rates per 1 million, just to round up to whole numbers. And when we looked overall, there was no difference in the suicide rate. We also had to collapse 5 years worth of data to have stable, but in order to do statistics with stability, we had to do that. No difference overall. When we looked at age, sex, and ethnicity, there was no difference overall in the trends. However, when we looked at race, what we found is that there was a significant increase in the suicide rate among Black youth, driven by increases in Black males, and a significant decrease in the suicide rate among white children, driven mainly by a decrease in white males. And so what you can see here is these are incident rate ratios. So it's practically 1 in the earliest period here. But in the more recent period, this is representing an increased incident rate risk of suicide in Black males. And so this is going through 2012. I've looked at data every year since this has been published, and this finding holds from 2012 onward. So then we asked the question, because we were focused in that study on children under the age of 12, and that was the first study to really identify this potential age-related racial disparity in suicide rates. So we did a follow-up study, and basically what this slide is showing is it's a comparison of the rates of suicide in Black and white youth by age group. And what you can see is that that finding that we found through 5 to 11-year-olds actually extends through age 12. And this was a finding that holds for both young Black males and Black females, whereas a different pattern emerges with white youth having higher suicide rates from age 13 on. Just to put this in perspective, if we look at suicide as a leading cause of death over these different time periods, you can see that in 1999, suicide among Black youth aged 5 to 11, it was the 16th leading cause of death, 12th in 2009, and now the 7th in 2018. And a similar pattern emerges for white youth as well. There was a study that was published recently by Brian Nishara and his group in Canada that looked at changes in suicide rates over time. And one thing I want to highlight here is, so to orient you to this slide, this sort of greenish, these circles, that represents the oldest group, 16 to 18-year-olds. The orange represent 12 to 15-year-olds. And then this represents 5 to 11-year-olds. And it's kind of a shame that they put all of this information on one figure, because it diminishes what happened right here. So from 2012 through 2017, the average annual percent change in the suicide rate among 5 to 11-year-olds, all 5 to 11-year-olds, increased 14.7% a year. So still relative to older adolescents, very low rates, but this is a concerning trend. Now I'm going to switch to suicidal thoughts and behavior. And so there's a gender or a sex paradox with suicide. So while males tend to have higher suicide rates, girls or females tend to have higher non-fatal suicide attempt rates and thoughts of suicide. And basically what this slide is showing from the most recent Youth Risk Behavior Survey data is that pattern. So across thinking about suicide, making a plan, attempting suicide, or making a suicide attempt that required medical treatment, across the board, females have higher rates. When we look at these data by race, what we see is that there's a difference here, and it's an interesting difference because white youth tend to have higher thoughts of thinking about suicide. But when we get into suicide attempts, the more recent pattern is showing that young Black youth have higher rates than white youth or Hispanic youth in terms of attempted suicide. And there was a really elegant paper that was published a couple years ago by Michael Lindsay and Dr. Sheftal from our group, looking at changes in suicidal behavior over time. And I'm not going to walk you through this particular picture, but basically what they found here is that young African-American males and females were the only group to see an increase in the suicide attempt rate over time. And particularly concerning was that for Black males, there also was an increase in attempts requiring medical treatment. Now I'm switching to, this is suicidal thoughts and behavior by self-reported sexual identity. So what jumps out here is that youth who identify as lesbian, gay, or bisexual have the highest rates of thinking about or attempting suicide. What is really, I think this is a key variable to include in these analyses is that this question of being not sure about your sexual identity, because you can see from the data that youth who fall in this category are intermediate in terms of their rates of thinking about and attempting suicide. So for survey data, this can be very helpful in terms of not just having a question that simply asks about identifying into one of two categories, but having an extra option. This last slide is looking at thoughts of suicide and behavior by the sex of the sexual contacts. And again, for youth that who've had sex with only others of the same sex, have higher thoughts and rates of attempted suicide across the board. So I know this was a brief presentation, but I wanted to give you sort of an update on more of the national and descriptive epidemiology of these behaviors. So thank you very much. If there's time, I'm happy to take a question or two, but I certainly understand that you have a full agenda. So.
That was an excellent